Levodopa is the frontline course of treatment for Parkinson's at any stage. This has changed, as it was formerly believed that it stopped working over time. It has now been concluded that levodopa continues to be effective for the duration of the disease. This is where it gets complicated, as extrapyramidal effects develop from taking it. Extrapyramidal effects essentially means overdose of a drug that can cause Parkinsonism or similar side effects. It is more often referred to in psychiatric settings as a result of antipsychotic drug administration. These side effects can be extremely troublesome and very difficult to control. The most common side effect is called dyskinesia, which is uncontrollable involuntary movements. That isn't the only side effect. It's kind of a blanket description of chorea, which is twisting and writhing, and dystonia, which is cramping and muscle rigidity. It is believed to be almost inevitable with levodopa use. The only current solution is to treat it with other drugs, making it even more complicated. These other drugs carry side effects that also require treatment. There are anticholinergics. These lower acetylcholine in the brain. They restore balance quickly when taken properly. Unfortunately, these drugs can worsen cognitive function when taken regularly. Anticholinergics are somewhat few and far between in practical use. Benztropine, piperidine, and trihexyphenidyl are the most common and are inexpensive. Most come in 2 mg tablets. Diphenhydramine, which is Benadryl, is also an anticholinergic that can be used in a crisis. When these drugs are taken, there is often need to increase the dosage of levodopa to counter the effects. You can probably see how the downward spiral begins. Once anticholinergics reach a dose of more than 6 mg in a day over time, they can lead to hallucinations. Initially, it is not literal hallucinations. It begins as a sense of presence behind you or peripherally. This is when the drug must be temporarily stopped. All of these medications must be dosed down to stop taking them. It can lead to a condition called neuroleptic malignant syndrome if you don't. This is somewhat similar to the off times with levodopa, but much more intense. Neuroleptic malignant syndrome can stop your heart from beating. It is quite serious. Once dosed down from these types of drugs for as little as 1 to 2 weeks, they tend to regain their effectiveness when reinstated. This is where ratios come into play. It's very important to take minimal doses of all of these medications. We'll get to dosage as we go. Other drugs include MAO inhibitors, COMT inhibitors, and some unclassified drugs such as amantadine. Amantadine is listed as a dopamine agonist. It is not. Amantadine is currently the first recommendation for levodopa-induced dyskinesia. It is unknown how it works, but it is believed to lower glutamate levels in the brain. Amantadine was specifically developed for a type of influenza in the 1960s. Amantadine is not without its side effects, which can develop over time as it is taken continually. Dosage of 2 100 mg tablets in the morning, 1 in the early afternoon, and another before 5 p.m. is standard. Amantadine takes several days to become effective. Side effects of amantadine can include anticholinergic effects, similar to freezing up, trembling, and in some cases postural instability. It must be carefully dosed down over 7 to 10 days. Then it regains its effectiveness and can be resumed. Amantadine must also be dosed up over 7 to 10 days when reinitiated. It then tends to be effective for another 3 to 6 months. Dopamine agonists are useful to a degree. The side effects are primarily related to compulsive behavior. Agonists prevent the breakdown of dopamine in the brain. The recommendations on dosing are largely responsible for the side effects of dopamine agonists. Manufacturers suggest increasing the maximum dosage, which is not necessary. Common agonists are pramexapol, which is Mirapex, ropinirole, Requip, and rotigotine, Nupro-Transdermal. Nupro has the most tolerable side effects, followed by Mirapex and Requip. I will not take Requip in any capacity. MAO and COMT inhibitors work in a similar fashion to the agonists. They are often not recommended due to adverse and possibly serious side effects. We will not discuss these. Try to avoid them. Currently, the frontline treatment is carbidopa-levodopa 25 to 100 and 300 milligrams of amantadine once dyskinesias develop. This combination is somewhat effective, but becomes difficult to manage over time. Amantadine can have serious side effects at doses over 600 milligrams daily. The maximum recommended daily dose of amantadine is 400 milligrams per day. So what do you do when you reach 400 milligrams? This is when you have to look at ratios and specific drug combinations. It can quickly become a roller coaster of trying to manage symptoms. Remember, it is important to use the lowest dose possible. Low doses help maintain effectiveness with most of the drugs. Levodopa should have the highest dose, as it is the one that allows you to move. More levodopa is also required to supplement lost dopamine-producing cells in the brain. You must pay close attention to the medication's effects and essentially tailor them to suit your needs. It can be completely different for each individual. This is why a cure seems so elusive.